Welcome to the first podcast from the Maternal and Child Health National Network. I'm Avery Lyons, a research coordinator for the network, and this October, I'm leading an awareness campaign focused on meeting maternal and child health needs through disaster preparedness and response. In the past 3 weeks, Hurricane Helene has caused catastrophic flooding throughout the Southeast, resulting in the tragic loss of at least 230 and possibly as many as 600 lives. 70% of these storm-related fatalities have occurred in the Carolinas. When natural disasters hit, pregnant and postpartum people, infants, and families with special healthcare needs are often among the most affected. This is due to additional challenges in evacuation, greater disruption to essential services that these groups rely on, and complications surrounding infant feeding when water systems are compromised. Today, I'm joined by Georgina Dukes-Harris, an Aspen Ideas Health Fellow and maternal and child health advocate based in South Carolina, to discuss these critical issues. Welcome, Georgina. First, can you tell us how you've played a role in the response to Hurricane Helene?
So honestly, we've been focusing mainly in the CSRA area. So think Augusta, Georgia, Aiken, South Carolina. So that area has been without power. Literally, that's my hometown. I'm from that area. So I have pictures of going there, like trees are down on light poles. I had to go evacuate family members. And so one of the things that just from a personal level, like making sure we're providing water, making sure we're evacuating people, allowing people to stay where it's safe, has been things that we've done. But as far as the technology, making sure that those doulas and those midwives, because we're trying to supply them with resources, have what they need to still actively do the work that they're doing to make sure women, especially women of color, are able to have babies in a safe way. We really work predominantly with home birth midwives and doulas, but we're still supplying the technology to make sure they're credentialed and make sure they're able to go meet the moms where they are because of the lack of power, the lack of infrastructure. They may not have been able to get into the hospitals or get to their providers as easy.
So this next question is a little more personal, so feel free to pass if you're not willing to speak on it. But I did see that you are a new mom.
Mhm.
Um, how has your experience been living through um both Hurricane Helene and the few weeks since then, and trying to navigate that as a provider and somebody working in the industry and also living through it yourself?
Yeah, I would say it's been really challenging just because I think that one of the things I've been kind of it's hard being a new mom, right? You just don't even think the same, you're not wired the same, you're always exhausted. And I just think experiencing Hurricane Helene, and this is the first time a hurricane has really impacted my family and my hometown this way, has been extremely heartbreaking because I was just telling my husband, he was like, should we be worried? Like, do your family need to evacuate? I'm like, a hurricane never hits them, like in South Carolina. It hits Charleston, but it never hits the like Midlands of the state. So we have nothing to worry about. And then it happens, and my family is without power. And then that means I have to bring them all here, right, for over a week. And so I'm now taking on this financial burden of providing for my family, making sure they have food, making sure they have the resources, and making sure I have everything here. It was just it was something that I just never would have thought with a 6-month old that and a soon to be 13-year-old that I would have to experience right now at this stage of life. But um all that to say, going through it was challenging, but now they just got power, like I said, Monday, and getting them back home and allowing them to feel safe in their own space, it just made it feel like it was all worth it in the end, if that makes sense.
Hearing you talk about your older family members as well and being a provider in multiple senses to your family, um, it brings up for me kind of the culture and kind of like implications of this region, that people outside of the South or outside of Appalachia might not have those assumptions of what your family structure looks like and what your responsibilities include. Can you speak to the landscape of this region before Hurricane Helene hit, both in terms of culture, with things like I just mentioned, and also the social drivers of health landscape and the population you were serving?
It is very limited resources, but it's a close-knit community. You have my grandmother who was the school bus driver. She was also the teacher's aide. She's the mother of the church. She was on the cooking committee. She does everything, right? Because it's such a small community. I think if you Google my hometown, it's called Monetta, South Carolina. The total population is 235 people, or either 253. I done mixed up the numbers, but it's that small. And so no stoplights, and you take a town like that where it takes 45 minutes to an hour to get to the closest like major city like Columbia or Augusta, Georgia, and you shut down everything, right? It's dirt roads, again, no stoplights. The only thing we got, and we got that probably like 4 or 5 years ago, is a Dollar General. And so that's shut down. Literally, there's a lack of resources. So these are gritty people who work on farms, who work in agriculture, who like really kind of make sure that they are able to care for themselves. Like there is no public housing. It's hard to access healthy food. So it's just a really gritty and rural community. And when you have a community that's already gritty and rural, a natural disaster like this can really take a toll on that community and really impact the community. But one of the things I've seen since the hurricane is that they all came together like I knew they would. They really empower each other. They really are connected with their resources. Like even my old band teacher, he made a post on Facebook saying he'll be at the school. We still don't have power, but there's running water for people who want to take cold showers. And he had a bunch of snacks that he went into the city to bring there. You know, you're not going to get that in a more urban area. The band teacher coming to the school and allowing like people's families to come and bathe and things like that. So I just think one of the things since after, it just shows that we were resilient and very connected. We were connected and really gritty community before, and since it shows that we're a more resilient and even grittier and connected community after.
That goes along with one of my questions. What special considerations do you think should be taken into account when addressing the maternal and child health recovery efforts in rural versus urban areas?
So I think when we think about the maternal and child, I think the thing is in rural areas, and that's we can't create urban solutions for a rural area. So in urban areas, you do have these physician practices everywhere, right? You can afford for a physician to operate and be there full time because there's the amount of patients to support, or there's the amount of resources there. And I just think if we try to plug these like more urban models in with the hospital and physician practice in these rural communities, we're going to miss the mark. In some of these rural communities, I think healthcare looks a little different. It may look like going back to what we did in the early 1900s with home visits. Like as my first time giving birth as a mom, I opted for a hospital. I knew that's what I should have done. But this time I leaned more towards a home birth because I thought that was best for me, right? And so I think we need to think through how healthcare can support these rural communities is by giving them more access to mobility, like mobile units that are willing to travel down these dirt roads, that are willing to do home visits, to provide doctors with an incentive to get out into the community, or advanced practitioners like nurse practitioners or physician's assistants, and empower them with a team that does wraparound care, like a community health worker or a doula. A community health worker for the social needs, a doula for the mental and spiritual needs, therapists, like to social workers, to really create this holistic view of care that is truly meeting people where they are, instead of having them jump through all of these hoops to get to the clinician. Does that make sense?
Yeah, it sure does. Thank you for that answer. And going along with that, I think coming from Appalachia myself, a lot of people have a misconception of what the people look like there. They think that there is no diversity, which is not true, particularly in Southern Appalachia. We know that Black people do live there and are
Mhm.
resilient and also face sometimes greater disparities than in urban areas. So, can you speak to how disaster systems can better integrate equity into the recovery efforts?
I think one of the ways that I feel like disaster systems can integrate equity is honestly is to actually talk about the demographics within the community, right? Because like you said, people don't naturally think that the Black community is in Appalachia, and they definitely didn't think it was in the CSRA where I'm from. As soon as I mentioned like a rural Southern community, they're like, that's for majority white people. And I'm like, no, 60% of Black America is still in the South. Like, what are you talking about? Like, but I guess people think inner city or something like that. So I think one, the type of pictures we see, like if you go to FEMA website and you go to a lot of these websites, you don't really see the diversity that is reflected. So as a marketing and communications type person, we need to definitely get more images out there that are actually reflective of our communities. I think we need more stories from the actual community to be out and broadcasted. And I think that there needs to be a level of intersectionality that we're missing, because I think that even in media, we tend to think certain sectors are a monolith, right? We think white America is this, especially with the election, that's all you hear. Geez, you think all Black people are a monolith, and there's so much diversity within a certain race of people. Like you can be Black, raised in the South, gay, Christian, and have a master's degree. But why don't we ever talk about all of those five things together and say that this person was impacted by Hurricane Helene and they're devastated, right? Like, so I think that there needs to be a level of intersectionality that recognizes people within their race, but also shows the diversity within each race and talks about it outside of what you can just see as far as their skin color, and really goes into some of those key images and storytelling aspects to make sure people understand we're not a monolith of what society thinks this race or is, if that makes sense.
Thank you. That's very powerful.
So I was thinking about the rural community too, and then the lack of access, like the lack of access to dignified housing, the lack of access to healthy foods, the lack of access to transportation. Like there's not even a transportation system there. I think when you have a really rural community that doesn't have access to some of these things that are just natural and more urban settings, it really exacerbates the disaster too. So when you think, well, Augusta is recovering, or you think that Columbia is recovering, even when I talk to my counterparts in the Asheville area, they're like, Asheville is recovering, but it's the rural communities surrounding these big cities that are really suffering because they lack that infrastructure that could significantly address their social determinants. So coming out of the hurricane, what I mentioned yesterday, that they have to really lean on each other. They have to get gritty, and they have to really help. I mean, all of them are providing water for each other. One person, because the rural community has a well and people are going to the well to get water in that community. Someone's supplying generators. So all of these like faith-based organizations and really gritty community-based organizations are coming together to supply the need. But it just shows that even though a community is smaller and it's more rural, there is a significant need for some type of infrastructure. And I think technology can play a role in that. Like there are companies like Unite Us, and that was one of the companies I worked for before, that have this technology infrastructure that allows people to send and receive referrals to address social needs. I think there are companies like that have been doing this for years, like United Way 211. And they have offices located in different rural communities. But I also don't want to forget about the actual faith-based organizations, especially in these southern regions. I mean, we're known as the Bible Belt. They really play a significant role in being that glue and connector in these communities as well. I'll stop right there. Yeah. Does that make sense?
Yes, and that actually was my next question, was how do you see community-driven solutions play a role in supporting Black mothers and children during disaster recovery?
particularly in your area. So it sounds like you've already started answering that. Do you
Yeah.
have more to say on that?
Yeah, so community-driven solutions. This is my thing. I love community-driven, especially technology solutions. So I think one of the things like talking to doulas, talking to home birth midwives, talking to lactation specialists, talking to child therapists during this time and being able to understand what they are experiencing. One of the things I feel like community-driven solutions could help is one, some type of solution that allows them to address social needs for these mothers and children. And I think what those solutions could look like could even be deploying community health workers across the state or across that disaster region. Community health workers, again, a non-traditional provider that really can fly in and do wraparound services and really understand the needs. They play, pray, and stay in those communities. So any type of solution that empowers a community health worker to come in and understand this child has had to miss school, or this child no longer has access to clothes and household goods, or this mother has been displaced, what type of needs do they need to make sure they're able to safely birth their child, as well as safely provide for their current children. I think solutions around that, again, like the coordinated care networks, like a Unite Us, or a resource directory and navigators like a United Way 211. I think those are vital. And then point-click solutions for community health workers, for them to find resource lists and for them to take on their phone or out in the community with them to help mothers and children navigate this space and get the access to all the services they need is extremely important. One of the things, though, that I will say that I haven't seen yet, that I feel like it's a definite need, that literally I had a conversation with a doula last night about, is someone that is some technology platform or community-driven solution that has an integration with FEMA. I get that, because it's government, like there's all this red tape, but we can't let red tape prevent us from really being there to support and provide wraparound services. Even in my hometown, like my mom had to do this, for every day they were without power, they had to submit an application to FEMA so that they could get reimbursed for all the groceries that were wasted and the smell in the house from all of the food. And that was a huge learning curve for a lot of people in my hometown. To be able to complete this significant application, they had to call them over the phone. The cell phone towers are down too, and they don't have access to landlines because the power is out. So who is coming and knocking on the doors? These local community health workers asking, do they need access to resources? And these people need access to whatever FEMA is offering them and that financial freedom that could help them dig out of this hole. But there's no technology solution that is user-friendly, that is like integrating with FEMA to make that application more, thinking about it from a health literacy perspective, thinking about it from a user-friendliness, because I deal a lot with UX design, thinking about it to how easy it is for someone like my grandma who's 80 years old to navigate and make sure she's applying for this the right way, or for a community health worker helping her to directly integrate with that when they're in the community making rounds. Sometimes I ramble, but I really think that is a solution, because a lot of moms needed the resources that FEMA was starting to provide after this disaster, and doulas weren't prepared. And so a lot of the doulas called on their community health worker friends, but they didn't have a technology, they were unaware. So there needs to be a whole accessibility tool or solution out there that really helps people get access to these FEMA resources quicker and be better informed on it and better prepared. Because I feel like disaster preparedness is one piece and then disaster response is another. And we could definitely tell, because of the lack of community-driven solutions that integrate with FEMA, the preparedness kind of fell through the loop and left us to all scramble when it was time for the response.
You're talking a lot about technology and integration into disaster response, or just a way to respond to community needs in general. But communication lines are one of the major ways that infrastructure is disrupted during natural disasters. So can you speak to how you navigate that, or how we can still overcome that by integrating that into our long-term response?
Yeah, so one of the things I think is really important that the Biden administration started implementing is creating broadband access in a lot of these more rural communities. I mean, my hometown was literally in some areas, still on dial-up. We're still on dial-up. Like they're just getting, because of that new implementation of broadband access, they're just getting access to Wi-Fi in certain communities, right? So I think it's an infrastructure issue around creating broadband access, so making sure all rural communities have this access and this lifeline. And I think that there's a piece of grassroots infrastructure that needs to be made. So there needs to be more of these community-based organizations. There needs to be more of on the ground ambassadors. Again, the community health worker piece, I do think helps a lot with that communication infrastructure, where they may not, it may be down during the hurricane, but there are people on the ground knocking on doors, making sure that people are well aware, or helping people evacuate into places where they can have access to communication so that they can communicate to get access to power or apply for these FEMA applications. So all that to say, I think those are two things that I think will help, is this broadband infrastructure and people really being serious about putting it in rural communities, as well as us understanding that you can have all the high tech in the world that I mentioned, because I work in tech, I love tech, but high tech is nothing without high touch. And if we don't have high touch points and these activation points that are going into the community, like doulas that are checking in on pregnant moms, like community health workers that are checking in on moms and the families, like home birth midwives that are making sure their patients are okay, then we can't improve the health of the community without that high touch aspect. Does that help answer or that question? Okay.
Can you, do you have any examples from people in your personal life or professional network, just stories from the field, around this like disaster recovery initiative, and now with Hurricane Milton hitting, like how that's affecting things? Are you hearing anything about that?
Yeah, so I would say one of the things, just a personal story from a doula who actually works in the hospital on the mother baby unit. So the amount of stress mothers are entering in the hospital from. So she was impacted in the CSRA area. And so she was still without power. And I think she might have just gotten power like one day this week. But during that whole cycle with the response, without power, she still had to go to the hospital. She's an essential employee. She works on the mother baby unit. She makes sure mothers are okay having their children. A hurricane is not going to stop when it's time to push. And so one of the things she said, that like her hospital said, you can bathe here because they still had power. You can stay here. You can sleep here, which is great. But she still had to show up. They need to get out the hospital. You can't just have them staying in a bed. They have to be discharged. And so we're discharging these women that's already in somewhat of a low income rural area back into the community, and they're going back with a newborn baby without power. So thinking about how that's impacting a mom and how traumatic that could be, especially if you're a new mom. You have no idea what to do with this little person. And I mean, the stores are closed, like especially if you were unable to breastfeed, or maybe you weren't educated on how to breastfeed. And so now you need to try to find formula. It's just been kind of a cycle that she said she's had to engage people and make sure that it's not, and it seems like it's a lot of PTSD there. And I think that that's something we need to think about, especially ahead if we know another hurricane is coming with Milton, is to say, how do we create different processes, different evacuation plans, different support systems within the hospital, where if someone's power is out, if the hurricane has significantly devastated our community, we're not sending moms out, because what we know is that maternal mortality, yes, it happens during birth, but over 50% of the deaths happen after they leave the hospital. That's when preeclampsia hits. That's when postpartum depression is the highest. That's when there could be significant infant mortality and SID. So there needs to be some kind of way that we're creating this cross-sector collaboration, partnering with hospitals, partnering with doulas, home birth, nurse practitioners that can do wellness visits during these disasters, where they're creating this wraparound ecosystem to ensure that percentage decreases around maternal mortality after they get discharged into a community that has been horribly devastated by a natural disaster. But I hope that made sense.
Lots of the maternal health complications, especially among Black women, stem from mental health as a major contributing factor. Do you see mothers in your network struggling with the fear around kind of preparing for and reacting to this disaster, managing like their normal postpartum mental health changes that they're going through? How do you see people kind of navigating like a stressful situation during a stressful time in life and still trying to prioritize like centering their mental health, knowing that that is like baseline a huge contributor to maternal mortality and other complications?
How are mothers dealing with the mental health issue? I just want to make sure I heard you right.
So you're having this like stressful period of life where you're normally going through mental health complications that are contributing to a lot of our maternal morbidity and mortality. So when you're looking through the lens of like disaster preparedness and response, we see that a lot of the early deaths from like Buncombe County and from like inland North Carolina, a lot of them, I don't know exactly how many, but a lot of the like more prominent stories I heard were like mothers who had just given birth, families with young children. That's in line with what we know about who's at high risk to like not be able to evacuate, who has higher medical needs. Do you have advice for people that are trying to take care of their family and their needs during this stressful time while also like baseline trying to manage stress because they're aware of it being a risk factor?
Yeah, I think that's a powerful question. And I want to answer it in two ways. One, personally, I mean, I told you I have a 6-month-old, and it has been extremely like my legs shaking down because just navigating, getting back to myself and trying to understand what it's like now to take care of this small human being, it has been devastating because you don't feel like yourself. And so but you're also anxious because you're like, is the baby breathing? Are they eating right? Like, oh, she's sneezing. Like, is she sick? All these things start coming through your head. And then you start feeling really bad. Like, I'm not doing enough. Why am I so sad all the time? Like, so you're going through this constant roller coaster. And that's what my therapist says, like this constant roller coaster of emotion between depression and anxiety. And it makes you just want to numb out and not overthink things and just be kind of in this really low place where you don't feel any emotion and you're just trying to feed your child, take care of the children you have, and just keep the house rolling. And then to layer on top of that a natural disaster where you're either having to evacuate or you're having to buy supplies to shelter in place, which is what we had to do, and fighting people over purified water in the store that you need for your formula and all these things. And then take the response piece where in your community, people have gotten pummeled. And so you're having to bring all these people evacuate to your house. So not only you already don't even think about yourself. You're thinking about this infant. You're thinking about the other children you have. You're thinking about your husband. And then you got to think about distant family members that usually aren't within your four walls and evacuating to your home. It creates this sense of chaos. And I'm okay. Like I'm a person that can afford therapy. I'm privileged in the sense that I can get to therapy. I can kind of navigate my way through it. But I think about how that's happened for my friends. I think about how that's happened for the other mothers in my network and for the other doulas, which leads me to the second part I want to answer this is they're not okay. And they don't have access to these resources. And I'm really scared for them. It is terrifying to, one, as a Black woman, give birth. Like literally my OBGYN said, this is a death sentence. Like that's how terrifying it is. And then you layer on top all of those other interconnectedness pieces where you're not only a Black woman, but you're a Black woman in a rural community. You're a Black woman in the rural South. You're a Black woman who's overweight or considered high risk already. And so then you layer in the trauma of being in poverty or not being in poverty, but a natural disaster happening that really impacts your ability to meet the basic needs of your Maslow hierarchy, like shelter, water, food, electricity. It can really impact your mental health. And we're already struggling with that. So I just see a lot of it on social media. I see a lot of it in the mother groups I'm in. And I don't have the right answer, but I think that there's something that all I can say is a call to action for something that needs to be done to do more to support the mental aspect of it and the spirit. I'll say the spiritual too, because we're in the Bible Belt and a lot of them are in need of that spiritual counseling mixed with mental health as well. That's my personal stuff, but yeah.
That is really powerful. I should think if I have any other questions. I had some prepared, but then you've answered some of them like in your answers to other questions. Do you feel the need to speak on anything else that we haven't touched on yet?
I'm trying to think. I talked about what the doulas are experiencing. I talked about the home birth midwives. I talked about lactation specialists, community health, where I did talk about that because I felt like that was something I thought about last night. Especially when you start asking about social needs and addressing social determinants of health. I think there needs to be a sense of community where people can get in touch. That's one thing. I'll just add that piece as an antidote that I'm noticing that's a need for these mothers. Like, who else is experiencing this? Because if they get that community sense, they'll feel like they're not alone. And there are platforms for that. Like there's this platform called Now Included, where mothers could join and really tell their story and feel like they're included and just really talk about what has maternal health looked like for them. And I think it'll be really important for them to talk about what maternal health has looked like for them when it comes to a natural disaster as well. So I do think there's a community aspect that could also help with the mental health pieces as well as navigating life during a response phase. But that's it.
Jogged my memory about a question I had about wraparound services. Do you have any examples of, I mean, my experience working in integrated community clinical care, and people that do wraparound services is like you are working with problem solvers. So, can you share some examples of ways that service providers have overcome barriers in the last few weeks to continue providing their services to their families, even ones that might be displaced or experiencing barriers accessing normal care?
So I think one of the ways that I've seen, especially talking with people in our community, is that instead of them having the patients come to them to the clinic or to whatever their location is, their safe haven, they've been switching their model to go out to them, to go to their homes and help them out within the home. Was this traditional model where people have to get to the clinic, people have to get to the hospital. I think when you talk to some, especially these birth workers that are prevalent in rural communities, they're starting to think about it in a completely different way, especially during a disaster where they're going out to them and doing wraparound services to them, where it's not a patient saying, oh, I'm out of housing, so I'm gonna go to the housing authority. Okay, I'm gonna go to this farmer's market or go to the nutritionist. Oh, I need maternal health or prenatal care. I'm gonna go to the OBGYN. They're navigating all these different spaces and using gas to go to all these different places where it should be like a hub and spoke where the patient is in the middle and all of these points are coming to them. And that's one thing that I'm starting to see is that people were really going back to that traditional, or they could say concierge model, where they were actually going to the patient. Even if I'm in Section 8 housing or staying in a trailer, like that's where I grew up in the trailer, like going to the trailer park and really creating a mobile unit where they are going and making sure all the moms are okay. The lactation specialist is working with the moms to make sure they're prepared to pump. The midwife is checking their blood pressure, checking all their vitals and listening to the baby, the fetal monitor to make sure the baby is okay. The nutritionist or the farmer's market is coming there and providing access to food boxes and vegetable boxes. So yeah, I think when I think about wraparound services, I think that it's the most needed thing to advance health equity in our nation, but I don't think that it should be all separated in these different buildings. And I don't think it should be a one-stop shop and just one building. I think we need to think about wraparound services as truly meeting patients where they are in their home. Like telehealth has tried to do that with the technology piece, but I think, again, you can have high tech, but you need that high touch. So actually people going out to the home to provide these wraparound services is vitally important.
Thank you for speaking with me today. I don't have any more questions unless you have something to add on. If not, I think this was a really fruitful interview, and I thank you again for meeting with me.